Hyperbaric oxygen therapy is an incredibly unique and powerful tool. Yet, so many people are just first learning about it today. If that's you and you're wondering what hyperbaric oxygen is or how it works, what the benefits might be, that is what we're going to cover in today's video. If we haven't met yet, I'm Dr. Jason Saunders. I've been practicing hyperbarics for over 20 years and teaching it for the last 8. Today, I want to cover the basics of the benefits of hyperbaric oxygen and the understanding of how hyperbaric works and why it's so unique. Hyperbaric oxygen therapy is breathing air or oxygen in a sealed hyperbaric chamber where the pressure is temporarily increased. So essentially, you're experiencing higher atmospheric pressure while breathing air or breathing oxygen. Like many other therapies or treatments, hyperbaric oxygen therapy has gone through a transition where it was originally used and designed for one specific purpose. And while using it for that specific purpose, it was observed to have a range of other benefits that patients would report. Through observation and then clinical use, and then eventually clinical trials, the range of uses or the range of reasons that we apply hyperbaric oxygen has grown dramatically over the last 20 to 30 years. Hyperbaric was originally used for diving medicine, scuba diving accidents, or accidents associated with divers at great pressures. And so that was emergency dive medicine only. It then transitioned from emergency dive medicine to really severe and acute life or limb conditions that are the on-label use of hyperbaric even today. These applications include severe infections like necrotizing fasciitis or gas gangrene. It's also used for non-healing wounds or very severe burns. And we even have applications for loss of hearing or loss of vision. And so in all of these cases, the traditional uses of hyperbaric have been geared toward acute life and limb types of conditions where, as a last step, pressurized oxygen is being utilized to save this person's life or to save this person's limb. As it turns out, the mechanisms for how hyperbaric works and what it's actually doing inside of our bodies when it's helping that diver in that emergency or helping these patients with infections or life and limb conditions, those key mechanisms and those key benefits are the same mechanisms and the same benefits that we can apply hyperbaric for the range of other applications that it's being utilized today. Hyperbaric should not be looked at as a cure for any condition, quite honestly, whether it's being utilized for an approved FDA application or an off-label use of hyperbaric. I don't believe that hyperbaric is the cure. Hyperbaric is a very specific tool driving your oxygen levels much higher than whatever would be possible under normal atmospheric conditions. And by driving this additional oxygen into the body has the fuel, the capacity to heal, regenerate, balance the immune system, lower inflammation, a whole multitude of benefits from raising those oxygen levels higher than the baseline level of oxygen that you and I are carrying right now. The amount of oxygen that you absorb into your circulation is really governed by the pressure that you're being exposed to. Once that oxygen is delivered, it's then carried by red blood cells to all the other working cells and tissues inside of your body. Many of us have had an experience at altitude, maybe going to Colorado from sea level or going for a hike on a mountain, and it feels harder to breathe. Well, many people say, well, there's less oxygen at altitude, but it's not percentage less. In other words, air is 21% oxygen at sea level, and air is 21% oxygen at the top of Mount Everest. The difference between those two places is not the percentage of oxygen, it's the amount of pressure. As you go up in elevation, you lose pressure. And as you lose pressure, you lose the driving force of how we get oxygen from our atmosphere into our lungs and into our circulation. Hyperbaric is the opposite of that. You're going into an increased pressurized environment. By temporarily increasing atmospheric pressure inside that chamber, whether you're breathing air or enriched oxygen, you will be driving higher levels of oxygen into your blood. Certainly will be saturating the red blood cells, but even more so will be supersaturating the plasma of your blood. Plasma usually carries very little oxygen, but under hyperbaric conditions, the plasma becomes a reservoir of almost unlimited oxygen, depending on how much pressure you're being exposed to, what percentage of oxygen you're breathing, and how long you choose to stay inside that chamber. And that is what makes hyperbaric so unique. And yes, there are other ways to increase your oxygen. You could use ozone therapy. You could use EWOT or exercise with oxygen therapy. You could also get a canister of oxygen and breathe it right here during this video. But none of those systems are doing what hyperbaric is doing because the temporary increase in atmospheric pressure is what allows us to maximize the amount of oxygen being carried by your circulation. Nothing else can do that other than pressure. If we choose to add oxygen to the therapy, additional enriched oxygen, that has a multiplying effect on the total oxygen we're delivering, but it's really the pressure that makes this possible. So as a result of going into a hyperbaric chamber, what types of changes or benefits might you expect? We can break these into 4 categories, and we've done very extensive and deep dives into the categories and the mechanisms of action of hyperbaric, and we'll include a link in the description below to some of those other videos. But as a summary, there are 4 categories of changes that a body might go through. The first category is mostly related to the original usage of hyperbaric in dive medicine, and that is not the oxygen, but the actual pressure of the chamber can help shrink nitrogen bubbles. So when a diver has an accident from a rapid decompression, nitrogen bubbles are expanding, and the pressure of the chamber helps to compress those nitrogen bubbles and push them back into solution so that they no longer have the capacity to injure that diver. The other 3 categories have a lot more to do with today's clinical uses of hyperbaric and/or even today's off-label and regenerative qualities of hyperbaric. And those other 3 categories are immunological, metabolic, and regenerative. Immunological in that, 1, hyperbaric, the oxygen level itself could be antimicrobial. Many of the pathogens that affect us from an infection standpoint are anaerobic, meaning they live in very low or no oxygen environments. And so raising the tissue oxygen tension helps to kill anaerobic infections. It's also immunological from the standpoint that hyperbaric helps to reduce systemic inflammation, and it does that through a number of different mechanisms. Metabolic, because the body uses oxygen as a way of breaking down the food that we eat to extract energy. And when we raise the oxygen levels inside of our body, we increase our metabolic capacity. And regenerative, because hyperbaric stimulates the release of a number of different growth factors and stem cells, all promoting the healing, the repair, and the regeneration of cells and tissues. So as a result, as you can imagine, there's a whole range of people who could benefit from hyperbaric. Just like it's used on label, tissue repair and infection, there's a range of tissue repair issues and infections that are not classically used in a hospital setting. Yet at the same time, for the same reasons that hyperbaric works on those very severe and life-threatening conditions, it also helps to repair tissues, fight infection, and balance the inflammation inside of our bodies. Our ability for our cells to produce energy is really one of the most foundational obligations of a cell to be able to do its job. Metabolic dysfunction, or specifically mitochondria, the part of the cell that makes energy, can accumulate damage over time, reducing the cell's ability to produce energy. So many of the chronic illnesses that people suffer with have metabolic dysfunction, mitochondrial dysfunction at their root. Driving oxygen into the cells, improving mitochondrial function, improving cellular energy is paramount for cellular and tissue repair, as well as just biological optimization. As a result, we see people coming to a clinic for hyperbaric or using hyperbaric oxygen at home who have autoimmune conditions, neurodegenerative conditions, chronic and subacute infections that are not responding to traditional treatments, chronic fatigue, fibromyalgia, cancer, TBI and concussion, or even other neurological damage or developmental delays. Again, hyperbaric's not a cure for any of those things, though people coming in with a whole range of health concerns like those seem to benefit from hyperbaric due to the increased oxygen levels that we're driving into that person for all of that immune, metabolic, and regenerative benefits that hyperbaric stimulates inside all of us. Obviously, this is just a high-level introduction to what is hyperbaric oxygen, how does it work, why is it so unique, and what are some of the benefits that somebody might expect as a result of going through hyperbaric treatment. But if you're wanting to learn more about hyperbaric oxygen, you can obviously cruise through this channel. We've done hundreds and hundreds of videos on hyperbaric oxygen, but a great place to start would be an introduction series, an HBOT 101, if you will, on a little bit more detail behind the science and the benefits and the mechanisms of action of hyperbaric oxygen. And so I'll pop a link on the screen where you can access that playlist on our hyperbaric introductory HBOT 101 series, and you can learn more about it. Hope you find this helpful. Thanks again for your time and attention, and we'll see you on the next video.